seriously sick. He needs an organ transplant urgently. And B doesn't know what to do.
What if one of the most powerful and private families in the world has been hiding a secret so serious it could change everything people think they know about them? Because right now, there are growing whispers surrounding Beyoncé, her family, and more specifically, her son, Sir Carter. According to insiders, something isn't right. In fact, some are claiming that Sir may be dealing with a serious medical condition, one that has now reached a critical point. And if the rumors are true, he may urgently need an organ transplant. But what's really raising eyebrows isn't just his alleged condition. It's the possibility that Beyoncé herself might not be able to help him in the way most people would expect a mother to.
Hollywood's seeing a bit of a baby boom, especially twins. Many of these moms-to-be, they're over the age of 35.
Well, now experts are warning that celebrities might be giving other women a false impression that it's easy to get pregnant over 35 without fertility treatment, a local doctor explains.
Now, before diving deeper, it's important to understand just how private Beyoncé has always been when it comes to her family. Despite being one of the most recognizable figures on the planet, she has carefully controlled what the public sees, especially when it comes to her children. Over the years, fans have noticed a very clear pattern. Her eldest daughter, Blue Ivy, has been in the spotlight since she was young, appearing at award shows, walking red carpets, and even performing on stage.
She was a child.
Blue Ivy, Beyoncé's 4-year-old daughter with Jay-Z, wore an $11,000 dress on the red carpet. Look at the gold metallic bodice and 3D gold metallic applique. And those casual sneakers, they cost $565.
What other hidden talents does she have that the world?
A lot of them.
Give us a couple more.
She paints, she draws, she does poetry. She's just a artistic soul.
Rumi, her daughter, has also made appearances here and there, often alongside her mother in carefully curated moments. But Sir Carter? That's where things start to feel different. Unlike his sisters, Sir is rarely seen. He doesn't appear at major public events, he hasn't joined his mother on stage, and even during moments when the entire family is present, he's often noticeably absent. For years, fans brushed it off, assuming he was simply more private or less interested in the spotlight.
I want to point out it's been over a year. Okay, let me be for real. I want to point out and say, you guys have produced Sir Carter. There he go. He a whole teenager.
But as time went on, that explanation started to feel less convincing, because when you look closely, the pattern isn't random, it's consistent, and consistency like that always raises questions. Those questions only grew louder when reports began surfacing about possible health concerns.
What is Sir interested in?
Sir is very quiet and is very, very smart and does all of the number stuff. So he's not into the fashion stuff as much, but yeah.
Okay. Blue as Kiara and hearing her voice come out of that character. Give me a second, because I'm still I can't believe that's my baby. Oh, that's so amazing. It was really hard to focus and to do my job after that. So I was like, wait, hold up, guys. Y'all gotta give me a second. I have to digest that. I'm so proud of her. Somebody wants to join.
As far back as 2018, there were claims that Sir had been rushed to a hospital shortly after landing in Europe. The official explanation pointed to something minor, an anxiety-related incident triggered by the noise of the flight, but many fans weren't convinced. To them, it felt like a carefully worded statement designed to calm the public without revealing the full story. And that's when the speculation really began. Over time, theories started circulating online. Some believed Sir might be dealing with a long-term medical condition that the family has chosen to keep private. Others speculated about developmental differences, pointing to the limited number of public appearances and the way he's been described by family members. At one point, Tina Knowles, Beyoncé's mother, addressed the curiosity by describing Sir as quiet, laid-back, and highly intelligent, someone who prefers numbers over attention. While her comments were meant to reassure fans, they didn't exactly put the rumors at rest. If anything, they added another layer to the mystery. Because behind the scenes, insiders have been painting a much more serious picture. According to some sources, Sir has been dealing with health challenges for years, and Beyoncé has been doing everything in her power to get him the best care possible. Treatments, specialists, privacy, everything has reportedly been handled with extreme discretion. But now, those same sources claim that the situation may have escalated, that it's no longer something that can be quietly managed. And this is where the story takes a dramatic turn. There are growing claims that Sir may need an organ transplant, a life-saving procedure that requires not just time, but a compatible donor. Naturally, many assumed that if it came to that, Beyoncé herself would step in without hesitation. But according to the rumors, she might not be able to. And the reason why is something that has shocked even longtime fans.
Some insiders are now claiming that Beyoncé may have used an egg donor when conceiving the twins, that Sir and possibly Rumi were conceived through IVF using genetic material that isn't entirely her own. While this has never been confirmed publicly, it's a theory that has been quietly circulating for years, especially given the circumstances surrounding her pregnancy. Back in 2017, when Beyoncé announced she was expecting twins, medical experts noted that pregnancies at that stage of life often involve fertility assistance. Around the same time, her husband, Jay-Z, publicly admitted to infidelity, something that added emotional complexity to an already intense period in their lives. For some observers, the timeline raised questions. Then there's Kanye West, who at one point made controversial remarks suggesting that IVF played a role in celebrity pregnancies. At the time, his comments were widely dismissed as speculation or provocation. But now, with these new claims resurfacing, some are beginning to revisit what was said and wondering if there was more truth to it than people initially thought. Still, it's important to remember, none of this has been confirmed, but the conversation is getting louder. And at the center of it all is a child who, according to these reports, may be facing a serious health battle, a child whose life could depend on finding the right donor, and a family that, despite all their influence and resources, may be facing a situation that money alone can't fix. Because when it comes to organ transplants, compatibility is everything, and time is never on your side. For Beyoncé, this would be an unimaginable position to be in. Known for her strength, control, and precision, she has built a career and a life on maintaining excellence in every area. But this is different. This isn't a performance or a business decision. This is deeply personal. And if the rumors are true, she may be dealing with it all behind closed doors, while the world continues to watch, speculate, and question. Some fans believe there have been subtle clues all along, from her decision to keep Sir largely out of the spotlight to moments in her documentary where he appears only briefly, often in quieter, more controlled environments. Even small details, like her focus on natural remedies or lifestyle choices, have been re-examined through a different lens. Were these just personal preferences, or were they part of something bigger? Because now, every past moment is being looked at differently. Every absence, every appearance, every decision. People are connecting dots, forming theories, and trying to understand what might really be going on behind the scenes. But without confirmation, it all remains speculation, and that's what makes it so compelling. If Sir truly does need a transplant, the stakes couldn't be higher. The process is complex, emotional, and often unpredictable. Finding a donor is only the first step. There are risks, waiting periods, and outcomes that no one can fully control. And if Beyoncé isn't a match, or isn't biologically able to be one, that adds another layer of urgency to an already critical situation. So now, the questions remain. What is really going on with Sir Carter? How much of this is rumor and how much is reality? And if the truth does come out, will it change the way people see one of the most iconic families in the world? For now, the Carter family remains silent. No confirmations, no denials, just a carefully maintained boundary between their private lives and the public eye. But as speculation continues to grow, one thing is certain: people are watching more closely than ever before, and they're waiting for answers.